ever find the time to take care of your teeth? About half of Americans don't floss daily, and 1 in 5 don't brush twice daily, so you're not alone. You should visit the dentist at least once a year, and the ADA recommends that you brush twice a day for 2 minutes and floss once a day. If you choose to ignore their advice, you'll get cavities, sure, but here are 5 other things you're at risk of, some more common than others. 1. Gum disease. Most people don't realize this, but your gums are not supposed to bleed when you brush and floss. If yours do, you probably have gum disease or are at least well on your way. Gingivitis, the milder form of gum disease, makes gums red, swollen, and quick to bleed, part of a response to the bacteria in the plaque that builds up between your teeth and gums. More than half of Americans have gingivitis. If plaque spreads, the immune response heightens and can destroy tissues and bones in the mouth, creating pockets between the teeth that can become infected. Other conditions unrelated to oral hygiene habits can also have these effects. At this severe stage, gum disease is called periodontitis, and it can become chronic. Google periodontitis, and you might become more vigilant about oral hygiene. 2. Tooth loss. If you've never worried about losing your teeth, you should start. Adults 20 to 64 have lost an average of 7 permanent teeth, and 10% of Americans between 50 and 64 have absolutely no teeth left. Both cavities and gum disease can end in tooth loss. 3. Bad breath. Bad breath, clinically called halitosis, may affect as much as 65% of the population. A number of conditions can have halitosis as a symptom, but the number one by far is poor oral hygiene. Food particles that linger long after meals can start to stink, and the less you brush and floss, the more potentially malodorous bacteria build up in your mouth. The coating on your tongue is also a key contributor to bad breath, and some research has suggested that cleaning your tongue along with regular brushing and flossing, of course, may help rein in this problem. 4. Dementia. A large, long-term study of residents at a Laguna Hills retirement community suggests that there may be a link between poor dental health and dementia, although it's possible that people with better oral hygiene have better health habits in general. Researchers followed 5,468 people for 18 years and found that among those who still had teeth, those who reported not brushing their teeth daily had a 22% to 65% greater risk of dementia than those who brushed 3 times daily. In addition, a small study found that the brains of patients with Alzheimer's had more bacteria associated with gum disease than did those belonging to the cognitively healthy. 5. Pneumonia. When pathogens lurk in your mouth, you inhale them right into your lungs, where they can wreak all kinds of havoc. One major review pointed to this process as the reason for an association between poor oral hygiene and hospital-acquired pneumonia. Improving oral hygiene through some methods beyond brushing and flossing in this case reduced the incidence of such pneumonia by 40%. Another study of 315 patients in a Brazilian hospital found that those with periodontitis were almost 3 times as likely to have pneumonia.